related disorders, especially cancer, heart disease, and stroke and kidney failure, being a powerful antioxidant. So we need to use it as a preventive tool in all these disorders. They are all deadly diseases. So Ganoderma can help you. And the other aspect, a powerful effect of Ganoderma is acting on the immune system, our defense mechanism. And basically, right from childhood, we need that our defense mechanism to be excellent so that we don't get any infections, deadly infections. And Ganoderma has been proved to increase two of the important components of the blood, interleukin-1 and 2 and interferon, so that we can fight against the disease. So all proved research material, whatever I talk. And it can mediate favorably both the humoral and the cell-mediated immunity. And of course, we give a lot of vaccines to prevent many deadly viral infections. And we have eradicated smallpox, now in the process of eradicating polio. It will be a polio-free world in another 5, 10 years or 15 years down the line by 2020, 25. Nobody will have polio. But the sorry state of affairs is that we get newer and newer infections like HIV, hepatitis. We don't know what is going to come in another 5, 10 years, because once our immune system is down, then these infections catch up. And we don't have an answer for HIV now. And that is going to kill a major portion of this population in the world. That is what the scientists have predicted. That is 1/3 of the population will be wiped out by HIV. Another decade or decade and a half. So the situation is very bad. So we need our defense mechanisms to be perfect, and the Ganoderma helps us, especially in children. In children, a lot of children die of ordinary infections. Diarrhea, infantile diarrhea, people die. Children die. Just like, mosquito or a fly, because their defense mechanism is lost, and especially if you have seen the television, they will show how the African countries, sub-Saharan African countries, their children dying. They are malnourished. So even the slightest infection will kill them. So you don't need a HIV to kill them, virus to kill them. Even a simple diarrhea can kill them. And there, one of the top researchers, he invented a small oral rehydration solution as a treatment to all these children affected with the diarrhea. And he was given a Nobel Prize. He did not discover or invent any of the high-tech gadgets or medication. He just said that you replace the fluid lost by the oral fluid. Oral rehydration solution therapy, and he was given a Nobel Prize. So what I'm trying to say is that the children we need to protect, and they need to have the good defense mechanism, and Ganoderma does that. So it is said that Ganoderma can be given from womb to tomb. Anybody can take such a powerful food supplement which can give. Immune system, it has got a tremendous effect as an immune booster. Then it's an excellent immune modulator, because some of the diseases could be due to the hyperactive immune system, and we call it as autoimmune disease. And there the Ganoderma has got a major role to play, because it can modify the immune system so that the immune related disorders can be controlled, especially the classical example being the rheumatoid arthritis. Polyarthritis known as a systemic lupus erythematosus. Somebody was saying about the ulcerative colitis, again an autoimmune disease. Somebody was mentioning about it. He came to my room and he was saying about ulcerative colitis. Again an autoimmune disease. Ganoderma can definitely help. But please don't stop the allopathic medications. They can give you immediate relief. So all the allopathic medications have to be monitored, and that the dosages have to be adjusted according to the physician's advice. Never ever stop any of the medications advised by the doctors in any field of medicine. Let it be Unani, homeopathy, Siddha, or whatever it is. You need that for immediate effect. Ganoderma will do its effect, its goodness only after a period of time. So we need to understand that. And one of the ways that the cancer cells can be killed is by increasing our immune system, defense mechanism against cancer. That's one of the proved the function of Ganoderma. And this is also an important effect that Ganoderma can increase the blood supply to the various organs. You have a very powerful component, the adenosine, which acts as a very powerful vasodilator. Vasodilatation meaning increasing the diameter of the vessel and increasing the blood flow. And if you take most of the diseases which happen in the old age is due to reduction in blood supply. Let it be a decrease in brain function or hearing, speaking, digestion, walking, everything comes down because of reduction of blood supply. And there the adenosine has got a very powerful role to play because it increases the blood flow in the microcirculation, meaning that the blood vessels which are 1/100th thickness of the hair, they play a major role in the blood flow and the perfusion of the every organ and tissue and the cell. So if they are in perfect condition, the blood flow is adequate and all the organ functions are protected. And especially in the old age, it is very important because you need to maintain that. And being a cardiologist, we advise patients to have a good blood flow. How do you do that? There are no specific medications to do that. Maybe we have one or two. For the heart, we have nitrates. For the brain, we have pentoxifylline. And apart from that, I don't think we have enough drugs. There are no drugs for increasing the blood circulation, especially the microcirculation. And especially there is a disease which is called as a microvascular angina. If you do a coronary angiogram, the major vessels will be normal, but the patient will be suffering from the blockages happening in the minor blood vessels, which are the capillaries. You can't do anything. There is no drug. So for them to increase the blood flow, you need a substance like adenosine. This adenosine is naturally present in large quantities. One of the major dietary source of adenosine is Ganoderma. And this adenosine, we use it as an injection now. When I did my DM cardiology in 1985, I never imagined that adenosine will be available as an injection. I never imagined. But today, scientists are able to isolate adenosine and give it as a drug. It's one of the drug of choice for a condition called which is called as a paroxysmal supraventricular tachycardia, where the heart beats very fast. And the American Heart Association recommends that adenosine is the drug of choice. You cannot give any other drug. If you give any other drug for a paroxysmal supraventricular tachycardia, you can be sued in the court of law. Previously, we are giving two drugs. One is verapamil, other drug is diltiazem. You can't give that because they are potentially dangerous. They can stop the heart. They can cause a cardiac arrest. So we don't use that. We do use a powerful drug which is called as adenosine, injection adenosine, again a powerful vasodilator. And here, since it acts on the conduction system, the nervous system of the heart, it is able to arrest the abnormal heart rhythm. The same, the other effect of this adenosine is, I said, the capillary vasodilatation, and that is brought on in the very small blood vessels. And that the effect, we use it for the perfusion scans, the nuclear scans, to study the perfusion of the heart under the gamma camera. So the adenosine is injected, and when the blood vessels are dilated, it gives an assessment of the perfusion, whether the blood supply is adequate, whether the blood vessel is able to respond to the drug. So the adenosine is one of the very powerful agent which is present naturally in Ganoderma. And to give you further information about this adeno